Bismillahirrahmanirrahim. This video is about the first step of practicing evidence-based medicine, and the first step is setting the clinical question. Okay, as all of you know, we have started the evidence-based medicine book of obstetric and gynecology, and this is from page number 3. Okay, so a very important thing I would like to say is that of generating an answerable clinical question is very important. That should be precise and specific, and that is the basis of EBM. And the development of a search strategy, okay, will flow from this. Okay, the search strategy will flow from that answerable question. And focused clinical questions include basically 4 components that I will discuss in the next slide. Okay, basically the search strategy follow from generating an answerable question. Okay, so focused clinical question include 4 components which are abbreviated as PICO. PICO. Okay, P is for population. Okay, population means a description of a patient such as their age, parity, clinical problem and healthcare setting. Okay, that is included in the population. Okay, and as far as ICO are concerned, let's move to the other slide. So I is basically the interventions or exposure, and these are the main actions such as treatment and diagnostic test or risk factors. Okay, so that is included in I, means interventions. Okay, the next component of PICO is that of C, means C is for comparison. Okay, the comparison group, for example, placebo or an alternative treatment. Okay, we have different groups and comparison group is C. Okay, what is O? O stands for the outcome. For example, the change in health expected as a result of intervention. Okay, so basically when we discuss the outcome, that is what included in PICO. Okay, now what determines the type of study? The type of study that will be sought is determined by the type of the clinical question. Okay, the type of the clinical question will determine the type of the study. Now, something about the treatment. Okay, question about the treatment. For example, a question about the treatment, the highest level of evidence is based on randomized controlled trial for diagnostic test accuracy studies that compare the new test to a gold standard test are needed. For a question about prognosis, studies that follow up groups of patients for specified period of time, that cohort studies are needed. Okay, now question about the risk factor. For a question about the risk factor cohort, okay, I'm writing the questions about risk factors. Okay, cohort or case control studies may be more appropriate. For cohort studies, the intervention may be an exposure rather than treatment or intervention, and additional factors like length of follow-up or time may be included. This is some time, a population exposure, comparison, outcome and time. That is PCOT question. Okay, PCOT question is population, exposure, comparison, outcome and time. Okay, now let us discuss an example of vague question. Okay, an example of vague question, like for instance, should we use antibiotic prophylaxis at cesarean section? This question should be focused in a number of ways, like population, intervention, comparison and outcome. Population, are you interested in all cesarean section or specific subgroups such as emergency or repeat cesarean section? And the country in which you are practicing and resource available may be important to specify. Secondly, interventions like antibiotic prophylaxis, do you want to specify the antibiotics? Are you interested in the dose duration of the use? And third is comparison. Is this compared with no antibiotics or with another intervention or another antibiotics or two different dose or treatment schedules? Okay, and outcome, what will be the different as a result of giving antibiotics? Okay, and will they reduce post-operative wound infection or other outcomes such as endometritis or UTI or other measures of the febrile or infective morbidity such as length of hospital stay. Okay, so these are vague questions. Now come to an example of focused question. Okay, an example of focus question is that for a woman having emergency cesarean section, does co-amoxiclave reduces the risk of post-operative endometritis compared with the co-amoxicillin? Okay, and this is the question about the treatment. So we would look for systematic reviews of randomized control trial. Okay, so that was an example of focused questions. So in these short videos, basically we just discussed